Recording in progress.
Good afternoon. Welcome to the County Executive's Weekly Media Briefing. If you wish to record, please indicate so in the chat, and we will begin momentarily. Over to you, Lorna, in 5, 4, 3, 2.
Be nice if I unmute. Good afternoon, everybody. Welcome once again to the weekly media briefing with Montgomery County Executive Marc Elrich, as well as the public health update. Today, joining the county executive, we have several guests, including Dr. James Bridgers, who is the acting health officer, Dr. Earl Stoddard, assistant chief administrative officer, Mr. Sean O'Donnell and Ms. Kimberly Townsend, both from the Department of Health and Human Services, as well as the director for that department, Dr. Raymond Crowell. Joining us also is Council President Gabe Albornoz, and this week's special guest is Health Officer nominee, Dr. Kisha Davis. Members of the media, please do use the chat when we open it up for the Q&A portion of this presentation. And with that, I toss it to you, Mr. County Executive. Good afternoon.
Good afternoon. Thank everybody for joining us today. I'm going to start by talking about the health officer. I'm excited to share the news. Montgomery County has offered the position of health officer to Dr. Kisha Davis. Today, we sent our nomination to the County Council, and I want to thank Dr. James Bridgers for the work he did in filling the dual role of acting health officer and chief of public health services for the past 13 months. Dr. Davis is a family physician, currently vice president of health equity at Airedale here in Montgomery County. She has administrative and leadership experience from her time with VaxCare Corporation, and she also served as medical director at CHI Healthcare, a primary care center in Gaithersburg. She's also been a White House fellow and serves on the as vice chair of the Medicaid and CHIP Payment and Access Commission. She earned her Master's of Public Health from Johns Hopkins University and her MD from the University of Connecticut School of Medicine. Dr. Davis is a Montgomery County native, and she actually graduated from Quince Orchard High School. And it's important to note that this is a joint appointment with the state. Her nomination has already been reviewed and approved by the State of Maryland Department of Health. I'm looking forward to welcoming and working with Dr. Davis in her new position. And now I'd like to turn this over to both Dr. Davis, and I know that Council President Albornoz wanted to make a couple of remarks. So I'll turn it back to you, Lorna.
Go ahead, Mr. Council President, your remarks.
Well, thank you so much. We really want to express our appreciation of the county executive for sending
newly minted, looking at the board of patients that were on the wall and who it was that I had to round on that day. And there were 13 on the board, but only 5 of them that I needed to see. And I commented to my chief, oh, it looks like, you know, not too busy a day, only 5 that I have to see. And he responded back to me, they are all your patients. And that has been my mantra and guiding principle in everything that I've done. After residency, I joined a community health center in Columbia, Maryland. And while there became frustrated with seeing patients with diabetes, and I would do everything that I could in the office to help them, but still more patients with diabetes came. And me in my exam room, their prescriptions were bigger than their problems were bigger than my prescription pad. I couldn't fix the fact that they didn't have a safe place to walk, or didn't understand nutrition labels, or didn't have nutritious food that would help their problems. And so I used that knowledge to really say, what else can I be doing? How can I better understand the healthcare system? And so I pursued a White House fellowship. And in that fellowship, I worked at the U.S. Department of Agriculture, really looking at the food safety net and the health safety net, and what is the interplay between the two of those? How do we think about healthier communities for patients, recognizing that part of health happens in the exam room, but a lot of health happens outside of that. And I think if there's anything that we learned from COVID, there's only so much that we can do, that there's so much opportunity outside of just in that exam room. After the fellowship, I helped to open a brand new practice called Casey Health Institute, then later changed its name to Chi Healthcare in Gaithersburg, Maryland, and we later moved to Rockville, where we really focused on providing whole person care, primary care, thinking about how do we center the needs of those patients, providing care to patients insured and uninsured, Medicare and Medicaid, really trying to be of and for the community. When I think about medical practice, it is about the patient that is sitting in front of you, but it is also about the community that surrounds you, because really they are all your patients. When that practice closed, I had the privilege of joining a company called Aledade that's actually based in Bethesda, that helps support independent primary care physicians, both in private practice and community health centers. And currently I'm in the role of Vice President of Health Equity, making sure that we are delivering high quality, equitable care to all of our patients. And so again, for me, it's how are we doing this for all of our patients? And, in this role, I see myself as really being that primary care doc for Montgomery County. And I'm excited to serve in the role. I'm excited to work with this high quality team of folks. I'm thankful for the foundation that has been laid in the past by Dr. Gales and Dr. Bridgers. They've done such a good job in responding to COVID. Really, Montgomery County is top in the nation for our response. And so excited to join this excellent team and really to come back home.
Thank you, Dr. Davis. Members of the media, we're going to open Q&A portion right now for your questions for the county executive and or Dr. Davis and the council president. I see on the chat that Stephanie Ramirez, Fox 5, has questions for Dr. Davis. Good afternoon, Stephanie. You need to unmute, Stephanie.
Okay, you can all hear me and see me, right?
Yes.
Okay, great. Thank you. You think I get it now. All right. So, Dr. Davis, thank you very much for your time here. I want to ask a few questions, if that's okay. One issue with the position we all know is that Dr. Travis Gales faced a lot of threats because of positions that were taken during the COVID pandemic, and that afterward, the county went through more than one candidate trying to fill that position. Do you have any concerns there? Why did you decide you wanted to take on this role, and when did you apply?
So it's been an ongoing process. I'll say just comment briefly on kind of what Dr. Gales experienced. I think COVID in some ways brought out the best and the worst of us as people, right? It in some ways showed us how we could work together, how we could work collaboratively, how we could pull across lines to bring resources together. And in some ways it brought out the worst in terms of some of the, furor that was thrown at him. I am encouraged by the support that the county gave him. And I hope that we are getting back to a period of more civility and, respect for the role. I am a Montgomery County resident, just like everybody else, and I'm accountable to the residents and the soccer moms too, who my kids play with. And so I think having that level of civility is really important. As mentioned before, I am a Montgomery County native for generations and generations. And so I am here to stay. My kids go to Montgomery County Public Schools. My husband works here. And so that commitment to this county is quite strong for me.
And then another question for you. So the school system and the county get their direction on COVID policies and other matters from the chief health officer. When it comes to the school closures, the masking, vaccine requirements that we saw, is there anything, since you seem to have experienced this with your children, is there anything that you would have done differently, or would you do the same thing over again?
I'm not here to play Monday morning quarterback, but when you look at the outcomes that we have had and the success rate that we've had in COVID, I would say we are sitting in a really good place. We have very high vaccination rates. We have seen, we have one of the lowest death rates in the country when you look at COVID. And so in terms of where we have gotten now, I think we have done a really good job. The school system has now a chief medical officer in place, Dr. Kapunen, and I look forward to working with her and having that collaboration as we think about the children of Montgomery County.
And then lastly, it's my understanding that Dr. Travis Gales. Can you talk a little bit about some of the conversations that were had before applying for this position?
Dr. Gales and I have gone to school together. I think he has done a good job in the role, and I, am proud of the work that he has done.
Thank you.
Thank you, Stephanie. Katie Ree, DC News Now. I see that you posted a question in the chat. Do you want me to read it, or do you want to ask it? Oh, there you are. Go ahead and ask.
Sorry, not to forget about this.
We can't hear you.
You guys hear me now?
Yes.
Okay, so again, like Stephanie, I think we have this figured out by now.
You might want to come closer to your mic, I think, because we lose the audio. Yeah.
So there has been a rise in RSV cases, in flu cases, and now also COVID cases. Some health officials are calling it a triple-demic. So, what are those risks of this triple-demic and having all of those illnesses at the same time? But also, could this be a step back towards masking?
I think it's too early to tell at this point, and I, look forward to working with Dr. Bridgers and the, health department and really figuring out what is the best thing to go forward. I think we have learned a lot in terms of when to use masks and when not to, and what the, the best use of them is. And I think that's a bridge that we cross when we get there. And I think, there is a lot of fear that might be put out there. And I think really getting back to transparency, what are the risks, what are the numbers, what are we really seeing? And I think, again, Montgomery County has done a good job so far in responding to these. And I think we've got that muscle memory and have laid really strong protocols in place for responding to all of these things that are coming our way.
Gotcha. And one last follow-up question. If these cases do start trending higher to a point of concern for health officials here in Maryland or elsewhere across the country, would that be something you would be willing to put in place to try and bring those numbers back down?
Sorry, you're breaking up. Can you repeat the question or put it in the chat?
If those risk levels do reach a level of concern, is a mask mandate or something along those lines something you'd be willing to put in place?
I think that's a bridge that we have to cross when we get there.
Thank you.
Thank you, Katie. Members of the media, if you have any more questions for Dr. Davis, this is your time to go ahead and ask. I'll wait a second. I do not see any more questions in the chat, but I'll wait a couple of seconds to see if anybody else has any questions for the nominee.
Hey, Lauren, if you can hear me, I do have some more questions. I want to give some other folks a chance, but if I can jump in again.
I don't see anybody else, so I guess you can go ahead, Stephanie.
Okay, I think we're on. I don't know. I think you guys can hear me. All right. So, yes, Dr. Davis. So, can you kind of talk about, or if another official can, the role that you would have on impacting the impact on kids, especially in school? You had mentioned that MCPS has their own health officer now. We know traditionally it was the county health officer who was making recommendations. But what is the actual role now when it comes to making decisions, the impact on kids, the impact on families as well?
I'll actually defer that to Dr. Kroll or Dr. Bridgers in terms of what that kind of synergy looks like at this point, because I think it's in flux.
Go ahead, Dr. Bridgers.
Sure. Thank you. Thank you, Dr. Davis, and good afternoon, Stephanie. So we've built a strong collaboration with our MCPS partners. In principle, with Dr. Kapunen, as Dr. Davis mentioned, so we will make those decisions in collaboration with them so that, of course, better outcomes, best outcomes for our students, faculty, and staff. It won't be any different decision-making processes in progress. Dr. Davis, as a trained physician, will make the clinical decisions and set the policies that set forth based on science and data, as we've prided ourselves on the past 2.5 years. So it won't be any shift in that. It will just be more collaboration. So if you take, metaphorically speaking, the notion of a safety net, our safety net has just gotten tighter, gotten stronger. And so we're able to have better responses, faster responses, and provide the best clinical update as possible. And so I'll stop there. I could go on, but with Dr. Davis on board now, we have a clinical expert who's able to not only collaborate with our Montgomery County public school partners, but our community as a whole.
And can someone discuss what that process in terms of going through how many applicants ended up being? You know, we understand some people had dropped out and the search had to go, and then the county executive, you had talked about dropping the requirement for a doctor to be in that position.
So I can tell you that we looked at a total of approximately 15 or 16 candidates. Someone has the exact number in front of me in the moment. We looked at about 15 or 16 candidates. We put forward a number of selections that this body, the press is aware of, and it got to a couple of points where got to a certain point, and the candidates that we had before withdrew for various reasons. Getting to this point, as we were getting ready to do our next round, we had some discussion and decided that this was an opportunity to take the opportunity to split the position apart. And it came at exactly the right moment, along with Dr. Davis showing up at exactly the right moment to join the team, to be put forward his nomination.
Thank you.
That's it. No more questions. I believe there's a question on the chat here. Any comment on mental health in Montgomery County, especially for school-age children, and lack of resources and support? Dr. Davis.
Yeah, I mean, I think everybody knows that there is a shortage of mental health professionals across the country, and Montgomery County has not escaped that. I know that the school system has actually trying to do a lot to, focus on wellness and creating some of those resources for our kids. But we continue to look and try to expand that mental health and behavioral health network for our kids and adults. And I look forward to working with the behavioral health division within HHS on really targeting what those resources are for our kids.
Thank you. Members of the media, any more questions for Dr. Davis at this moment? Please use the chat. We'll give you a second. Going once, going twice. Stephanie, your hand's still up. Okay, thank you. That's it. I think we don't have any more questions at this point for you, Dr. Davis. So, Mr. County Executive, may we continue with the public health update and other information? Yes,
you may. And thank you, Dr. Davis, for joining us. And I look forward to working with you. This is going to be you're in good hands. And we had a really strong team going through this. Dr. Bridges, you did a really outstanding job of performing the dual roles you had to perform. So I know that Dr. Davis is going to come into a department where she has lots of support and a lot of folks who are, actually were experienced and handled this, I think, really well. With or without a health officer, did a remarkably good job. So thank both Dr. Bridges and Ms. Davis for stepping up to move into this new position for us. So we're going to talk about a few other things. First, I want to make a brief comment about Thrive. Obviously, the council passed it yesterday. I am really disappointed in the council's vote. Some of the leading supporters of Thrive framed this as what we needed to do in order to house people who are coming here. And they cite this 200,000 person number. I have to say that, this is just patently not true. That number comes out of a process, a planning process in which all of the agencies, all the counties in the DC region go to their planning departments, and the planning departments make projections on how much they expect their counties to grow on a 30-year period based on the existing zoning. When those projections were made for 200,000 people, which I do not dispute that is the projection, it was based on the existing zoning, not Thrive, not the proposals made by Thrive, but on the zoning we put in place. And when they talk about missing middle and the need for, market rate housing, 85% of all the housing units that they've planned on over the next 25, 30 years, 85% of them would be market units, because the most affordable units we get from new development is between 12.5% and 15%. Our problem in the long run and the short run is not building market units. Our problem is building affordable units. And the yield of 15% affordable units out of every 100 units that are built is simply not adequate either to address the problem that exists in Montgomery County today. Most people who are lack adequate housing in the county today don't qualify for the subsidized housing that we do provide. It's not targeted on people below $60,000 in income. And the county's done over 20 master plans in 16 years that created the zoning capacity for the future growth of the county. So this persistent misstatement of, where we sit in terms of zoning and our potential for growth is really frustrating. And I'll just, point out that two of the things in Thrive's, the document itself, which ought to disabuse people of the idea this was about affordable housing. One was the statement that said clearly that the county needed to end its sole focus on affordable housing. A county that produced 6,700 affordable units over almost a 50-year period didn't actually have a sole focus on affordable housing. In fact, it had virtually no focus on affordable housing. We got a relatively small number of units compared to the need. And the other part of that document, there's a sentence that says this housing is meant to serve unsubsidized market rate housing in the county. That's unsubsidized market rate housing, which means not affordable housing. So this document's not about affordable housing. It doesn't address affordable housing in any substantive way. And there are a lot of people who bought the rhetoric, and I get that people don't read documents very carefully. I don't blame people for not reading every document that gets produced. But the fact is, when you read this document, it doesn't do what it says it's going to do. And that's really disappointing. I pointed out in my most recent memo to the county council, as I pointed out over the past 2 years in multiple memos that we sent to the county council, there were important questions that never answered. That's why I asked them to postpone this vote, because there's no urgency to vote right now. And there are multiple errors there. And there was a totally insufficient attention to racial equity, which we raised multiple times. Looking forward to working with the new council and the new planning board as we try to figure out how we're going to address the important issues that were not addressed by Thrive. To be blunt about this, I don't know how you plan a future of the county. If you are not including in your planning, what do you do to address the housing gaps that exist today and the housing gaps that are likely to be created in the future. Absent doing that, it's a picture of a county in 2050 that leaves out a whole lot of county residents. On a brighter note, this week I was very excited to see Montgomery County Public Schools expanding its electric bus fleet. Now has more electric buses than any public school system in the nation, and those numbers will only continue to grow as we move forward. I want to thank the school district for adopting the county's climate goals and acting on them. Electric buses cost more until you factor in the tax breaks our contractors get, and then it becomes comparable to buying a diesel bus. And in the future, this move is going to pay big dividends because these buses not only reduce greenhouse gas emissions, they use less fuel and they require fewer repairs. They will be easier and cheaper to maintain than diesel buses are. I want to give credit to the students in MCPS because they've been unrelenting in putting pressure on myself, the council, and on the school system to take more aggressive actions to deal with climate change. You know, we're creating a world that they're going to inherit. And if we don't create the right world, we're not going to, what we'll be handing them is an even bigger mess than we're giving them today. And there was yet another story. I didn't get to read the whole thing this morning, but basically we are not going to meet the climate goals we need to reach to avoid even more serious global warming. And global warming has multiple consequences. I'm not going to repeat them all, but we've got to do a better job, you know, particularly as a nation and globally. This announcement came just 1 week ahead of another important milestone. This Monday, we open our Brookfield Bus Depot, which is the new standard for sustainable public transportation. It's going to have its own energy source with solar panels and batteries. It creates a microgrid, and eventually we are going to have an all-electric fleet of ride-on buses, and hopefully we'll be able to move that even more quickly than we're planning on doing it now. So those are two big milestones. It's really good to have the school system as a partner in this, and I look forward as we continue to push forward on addressing climate change here in the county. In other good news, this week I sent a $15 million supplemental appropriation request to the County Council to prepare the North Bethesda metro area for an exciting project with educational research partners that will bring an advanced computational research capability to the county. The money is going to be spent on essential startup costs and operational needs. They're going to focus on virtual reality and artificial intelligence, machine learning, big data, all those buzzwords you hear about that are coming increasingly into play in the world of life sciences. And this is going to be focused on both life sciences and also doing some work for our hospitality industries. We're going to have more detail on this. We're going to be doing a press conference in a couple of weeks. So I'll tell you more about it when we get to the press conference, but it's really exciting. It lays down a really important marker for Montgomery County, and as part of an agreement we reached with the University of Maryland a couple of years ago to bring life sciences research to Montgomery County from the university system. So I'm very excited about this. In our health update this week, flu-like symptoms have been driving up visits to doctors' offices and hospitals nationwide. And in some areas of the country, the situation is actually alarming. They're beginning to fill up, particularly their pediatric beds, but it's putting strains on the healthcare system. Children's Hospital in the district is among several area facilities that cater to the children, and they're at or near capacity because of these respiratory illnesses. We're dealing with a combination of COVID-19 and its variants, and we now have multiple variants that are sharing the stage rather than just one main actor and a couple of sub-actors. So that's been a change. We've got the flu, which many people are expecting to be a little bit heavier this year than it was in previous years because we're mostly unmasked right now, and what kept flu numbers low, and frankly, probably the childhood respiratory virus problem kept that lower was the fact that everybody was wearing masks and more separated. As we all come back together now, all of these respiratory diseases are going to be spreading more easily. And to the point of an earlier question, that's why we're going to have to pay close attention to the hospitalization rates in the county, because these three can combine to put our system under pretty severe stress. Health experts say that the rise in cases in hospitals doesn't have as much to do with COVID-19 as people think. The flu cases are, a part of this, and as is the RSV virus. The RSV virus affects mostly younger children and seniors, and it has more severe effects on seniors who are health compromised and on young children who are health compromised. So we do have these three viruses that we're going to have to deal with. And as we see its impact on hospitals and on the community, we will be deciding what's the appropriate course of action. As for COVID-19 this week, our current case and hospitalizations remain low, and we want to keep them that way. I'm concerned for the upcoming winter, as are lots of scientists right now. There's already been a surge in Europe, and when Europe surges, we're usually not too far behind. I think we're about a three-week difference between us and England. Wastewater detection surveillance is starting to see upticks of cases in the Northeast, including in nearby Pennsylvania. And we must be deliberate in our efforts to protect ourselves and our families. We're going to have to keep severe cases at a minimum and our hospitalization rate in this county as low as possible. I know that the federal government is talking about the critical importance of people getting boosted and people getting the flu vaccine. This is one of the lead stories this morning. We can avoid most of the deaths that are caused by COVID if people would just get vaccinated. I've said this before, we're at the point when virtually nobody needs to die from this if people will come out and get their vaccinations. So we're encouraging people, please get vaccinated and get the flu vaccine as well. Hospitals are seeing patients with multiple viruses. That just complicates health outcomes and puts more stress on a person's body. Earlier this month, Yale University and the Commonwealth Fund published a scientific blog showing how much investment in booster marketing and promotion now will save lives and money in the future. The study looked at our current vaccination rates and compared them with two other scenarios. One that had flu-like vaccination rates, which is about 50% of the population. And the second scenario is what would happen if we achieved 80% coverage of our booster rates. And as you can see from the graphs they published, it's clear the number of projected hospitalizations and deaths that can be avoided is pretty substantial. It also equates into costs and strains on our healthcare systems. The study also estimated that direct medical costs could be reduced by $11 billion from Medicaid alone under the flu level vaccine scenario and $13 billion under the 80% boosted scenario. An additional 3.5 to 4.5 billion in savings would accrue to Medicaid as well. So this isn't just a health issue, it's a financial issue. We don't need to be spending money. People don't need to be dying. We ought to be doing everything we can, and we'll continue to do everything we can to encourage people to get the boosters, get the flu shots, and consider whether or not to wear masks voluntarily when you're going into more crowded places, because now you have three things to try to avoid. This Saturday, we're going to be hosting our third Boosterama, speaking of boosters, at the Westfield Wheaton Mall. I want to thank Westfield again for their support of our outreach efforts. And they offer 5 $50 gift certificates that'll be raffled off to those who get boosted this weekend on Saturday. And so please help us promote Boosterama and join us on Saturday in Wheaton. I also want to take a moment to thank all the volunteers, the individuals, organizations, and businesses who volunteered their time and efforts during this pandemic. Tomorrow night, I'm going to be attending our Medical Reserve Corps Volunteer Appreciation event to meet and thank them in person. At the end of August this year, our volunteers had worked more than 82,000 hours and saved the county and our taxpayers over $3 million. And that doesn't include medical costs avoided by the people they were able to help. This reflects the compassion and commitment of our residents for their neighbors and during the toughest of times. And there are also other people to thank, but a lot of them we're going to be trying to acknowledge in this one volunteer event. So thank all of you very much. And I hope if you individually know people who served as volunteers, let them know how much you appreciate the work they did for the county. Dr. Joseph Chewy, the resident of North Potomac, gave more than 500 hours himself, and mostly as a vaccinator doing COVID testing. And he's an infectious disease doctor and knows how important public health is. And volunteering was a way for him to use his medical training to help the county, and his efforts were quite a gift to the county. So I hope you consider covering or featuring our volunteers and volunteer programs, and their stories will always inspire others to help out themselves. In many ways throughout COVID, volunteers played critical roles to support the county, not just in the health arena directly, but in passing out clothing and food and hosting clinics. Volunteers helped make the county's response as effective as it was. And I just want everybody to know how much I appreciate what they did. And lastly, for my part, just a few words about MPX or monkeypox. There's only been one new case reported in Montgomery County in the last 2 weeks, and this is great news. It demonstrates our outreach and community efforts are working, but we must continue to vaccinate high-risk individuals. Hundreds of people have asked for and now received the vaccine for monkeypox, MPX, and we're going to continue sharing information about its spread and how it spreads from skin-to-skin contact, because education about disease is one of the best tools we have in terms of preventing more cases. We've made great progress, but we can't lose sight of the problem and make sure we continue to pay attention to it. So I'll stop there and turn it over to Sean for his presentation.
Thank you, Mr. County Executive. So just to start out, as we've done in previous weeks, we continue to monitor those variants that are distributing or being transmitted throughout our region, as well as throughout the US and in Europe. This is the snapshot of our region of the country. Again, most of the cases, most of the variants that we're seeing right now are BA.5 or a subvariant of BA.5, which includes the two BQ subvariants, the BF subvariant. Again, as these are all related to BA.5, it's important to know that, because that is a component of the bivalent booster and why we recommend that booster so much. Even if you've had previous boosters, it's important. Everyone who's eligible for a booster can now get the bivalent booster, age 5 and up. Going on, as our county executive shared, we have seen the COVID transmission numbers come down via the PCR test surveillance. That's a good trend. However, we are seeing, conversely, some increases in hospitalizations. It's likely because of the increased overall respiratory and febrile illnesses that we're seeing that are serious enough to cause people to go to an outpatient clinic or go to a hospital, that is allowing us to catch more people who may also have COVID as a contributing or more significant component of their illness. But we are seeing that increase in patient beds with a COVID diagnosis and continuing to track it. Our hospital beds are very similar with the COVID patients. Many of those patients have been transferred over to the alternate care site if they need extended care rehabilitation following their initial hospitalization with COVID. And so we're seeing that ACS number increasing week to week. It's now about the highest it's been since the beginning of October. Again, we're encouraged that people continue to come out and get their booster shot. At this point, they're all bivalent boosters, which is great. And we want to keep encouraging it. We know that people pick this time of year usually to go out and get their flu shot. And we know we're asking them to get also a COVID shot at this time. Looking at our influenza surveillance, this is the national surveillance. You can see again that we are on the uprise for flu transmissions across the country. And so that's again why we're letting people know that even if you have a negative COVID rapid test or PCR test, there could be other even serious respiratory viruses like the flu that are out there. The flu is likely not hospitalizing as many people as COVID, but it's still contributing to those cases. And if someone is unfortunate enough to get both flu and COVID, certainly they're likely to have a more difficult time of it. Looking at the overall vaccination levels for influenza, we are likely about halfway to our annual number of vaccinations. In Montgomery County, we have about 18% of our population who've gotten that flu vaccine. In many years, it tends to be in the mid 30 percentile. We're hoping that with the earlier onset of influenza this year, of the influenza season, that people take the precautions, and we'd love to see that that vaccination rate for influenza be much higher this year. But this is where we are currently. As you can see again, many of our seniors are getting the influenza shot, and that is usually at the direction and request of their healthcare providers. And there's also a pneumococcal vaccine that is recommended at that age group. But again, we're recommending everyone get the flu shot this year. Going back to the RSV or respiratory syncytial virus, as we mentioned last week, this is again a respiratory disease that usually manifests as a mild illness with cold-like symptoms. It does affect a lot of children, but the individuals it's most dangerous to are those very young children, or those with very young children with underlying health conditions. And it can be life-threatening in that case. It can cause bronchiolitis and other secondary infections. And so we do recommend any parents who have newborns, very young children, if they have a respiratory illness, please, or any illness, please contact your healthcare provider. Even if you have a negative COVID test, it's important to talk to your healthcare provider and rule out something more serious. RSV can also be dangerous, again, to our seniors, whose immune systems are not as strong as those who are younger. And so the guidance is really similar to COVID. If you're in a higher risk group, please consider using a mask when you're in high density public places, particularly if it's indoors, to help prevent these respiratory spreads. Again, what we're seeing is this, the RSV is, compared to previous years, occurring a little bit earlier in the season. That's this line over here on the left that is still going up. You can see it's several weeks earlier than what we've seen in previous years. And we're seeing the test positivity very elevated right now. So again, messages have gone out from the state health department out to our healthcare providers, recommending that that they also rule this out amongst populations who are at risk. Looking at our Mpox cases, we'll go through this quickly. The good news is that the cases are coming down. However, there are still some transmissions in the state of Maryland. As our county executive mentioned, we've had, you can see the cases coming down nationally. Within our county, we've only had one new case identified in the last 2 weeks, but we're still doing the disease investigations, trying to make sure that we have as few transmissions as possible after identifying a case. We do continue to offer vaccinations in the county, both in the Silver Spring Wheaton area, as well as up county as well. So if you're looking for a vaccination for this, please go online, let us know by completing the pre-registration form. We may begin taking walk-ups very soon. We're trying to coordinate the timing of that with our state healthcare partners. Vaccines are also now being distributed out to some additional providers beyond the health department, including some healthcare facilities and some pharmacies. So again, we're just trying to broaden the access to these vaccines. That is the update right now from public health. I just want to again echo our county executive's comments of how much we've appreciated the volunteers who have worked with us over the last several years with COVID. They've made an unbelievable impact to our ability to respond. They were among the first people who showed up to help us answer the phones when people were calling in with illnesses, and to try to identify contacts of those who were ill. And they've worked in every phase of our response. And we truly wouldn't be where we are today as a county without their help. Now I'd like to turn it back over to Lorna.
Thank you, Mr. O'Donnell. Then I believe, Ms. Thompson, do you have an update, or was that included on Mr. O'Donnell's?
Mr. O'Donnell covered the MPOX for us this week, so thank you, Mr. O'Donnell, and thank you, Lorna, for checking.
Thank you so much. Dr. Stoddard?
Yeah, I just wanted one additional piece of information. I was privileged to represent the county executive on Monday with the governor announcing the Maryland Mesonet program, which is actually a partnership that's being established at the state level between the Maryland Department of Emergency Management and the University of Maryland School of Atmospheric Science. Basically, a Mesonet it's going to be 75 stations, weather monitoring stations across the state that are well integrated. They take samples every few seconds, then aggregate them over about a 5-minute period. They'll provide information to local emergency managers across the state who will be able to provide better warning in advance of weather events. They'll also be able to respond to weather events and allocate resources in a more effective way. And the reason why Montgomery County was invited is actually this program originated out of Montgomery County. It came from some of our early work around the climate action plan that the county executive had directed immediately upon his election in 2018. And obviously, we saw the value of increased data availability in understanding the impacts of climate-driven weather changes. We carried that message up to the state. The state embraced it and all the way up to the governor, including it in his budget this year. And so obviously we're incredibly pleased to have been a big part of the origination of the project, and we look forward to that project being completed over the next few years. It will provide us critical data in Montgomery County and across the state of Maryland in how we more effectively adapt to and respond to climate change in our future. So thank you very much.
Thank you, Dr. Stoddard. Krista King, I believe you had your hand raised up before we transition to the public health update. Do you have any questions? Although I believe that Dr. Davis has left the platform for this afternoon. No, Christy? Okay. Next up, reporters, remember to use the chat for the Q&A portion of this presentation. And I do see that Stephanie Ramirez has a follow-up question for the county executive and health department officials. Good afternoon again, Stephanie.
Hi again. Thank you all. Just a quick follow-up question. Can someone explain the difference in the experiences here? You said that Dr. Davis has clinical experience, whereas we know Dr. Travis Gills, his work was as a child physician or pediatrician. Can you explain the differences, please?
Sure, I can do that for you. There's essentially it's the same thing. Dr. Gales was a pediatrician, which meant that he had at some point in his career clinical experience as well. And Dr. Davis is describing essentially the same thing, that she comes to this job with a wealth of clinical experience, albeit not as a pediatrician, but in other areas of medicine.
What other areas of medicine are you talking about then? And then obviously then more so with adults.
I think, yeah, more so with adults, but I think family medical practice is how she described it, which is about the care of not just the children in the family, but the adults and older family members as well. So it's across the spectrum of healthcare for an entire family, and from a more holistic perspective.
The other thing that I think Dr. Davis alluded to this in her work with Alidate is that she has focused a lot on health equity, which means not just on the practice of clinical medicine, but also the wraparound services that you aim to address the underlying inequities that lead to those health outcomes. Like she used the example of diabetes, which is often diabetes is often a manifestation of underlying issues in someone's life that may be lack of healthy food, lack of access to exercise. And so I think Dr. Davis has a really well-rounded understanding of not just what the clinical manifestation of disease is, but how an individual may have gotten to that point and how you can avoid them getting that in the future.
Dr. Bridges is right. Dr. Stoddard is right. One of the things that that I appreciate about her being here is that we in the department are working from a framework of social determinants of health, which is not just the work in the public health space, in the public health service and primary care, but is also about all those things that contribute to health and well-being, from an aging perspective, mental health issues, housing issues, nutrition, exercise, diet, and rest. All of those things are part of the largest scope of the department. So her joining this will help us to make sure that there's a better integration across the department on between health and the human services elements that support health and well-being.
Thank you.
Thank you, Stephanie. Members of the media, I do not see any more requests for questions on the chat. I'll wait a second or two to see if anybody else has questions. I don't see any hands up here on the chat. Oh, Katie, Reed?
Yes, sorry, I just wanted to park my car before we asked a question. Make that I want to. So this one is for Health and Human Services. It's the same question that I asked earlier to so we are seeing those rises in cases. We just saw them, but while cases look pretty good in Montgomery County, is a mask mandate potentially a recommendation? This is for Health and Human Services and others who can comment on this.
Did anybody hear the question well?
Yes,
Okay,
yes,
you
Lorna.
did,
So
Dr. Bridges?
think,
Okay.
So Katie, I think Dr. Davis answered the question. We haven't gotten to that bridge. We still continue to use data analysis and assess what the science is guiding us on. There hasn't been an impetus to return to an indoor mask mandate. Yes, there are 3 viruses that are out in the community. COVID hasn't evolved into a seasonal virus-like illness. This has been with us for 2.5 years and counting. RSV and influenza typically occur when folks go inside, tighter spaces, fall and winter months, and they are controlled. So when you look at all 3 of those viruses, those lower respiratory and upper respiratory viruses, we look for individuals to do a couple of things: to consult their primary care physician regarding their illness, because there may be other underlying health conditions and chronic illnesses that they may have that may require them, especially if they are immunocompromised at any time throughout the year, to wear a face mask. Clearly, in indoor crowded spaces, individuals have the options of wearing face masks if they still have some challenges or still suffer from the effects of long COVID and have some respiratory inflammation or some other respiratory illnesses that would require them to wear a mask. But we need to continue, and we will continue to assess whether or not there's a requirement to wear a mask, and if and when to wear a mask, either in a community setting, either in a school setting, or as a community as a whole.
The only thing I would add is masks can be an effective tool to slow the spread of respiratory virus like COVID or even influenza. It can be positive. Influenza more might spread, but I digress. The most effective mechanism to prevent the spread is vaccination. So we're focused on the vaccination efforts at this point, and any decision by the health team to recommend masks again to the county council would only be that would be a far down pathway that we would consider. And obviously the focus right now is making sure people get vaccinated before we see our winter surge. And so you never say this could never happen again, because obviously masks do work and they're effective, but I think the focus area is obviously much more on trying to prevent us from getting to the point where we're having those conversations.
Thank you so much.
Thank you, Katie. Any more questions, members of the media? Going once, going twice. I guess we're done for today. Thank you, everybody, for joining us. Have a great afternoon. Stay safe, and we'll see you again next time.
Thank
Bye-bye.
you all.
Thank you.